Yoon Irons. Derby is in Western Australia, but Derby is in Midland, next to Nottingham, and an hour away from Manchester. So it's a small university, and I work there. And this presentation or this work is done with my colleagues. David Sheffield is a health psychologist at Derby, and Trish is a colleague and friend who runs a charity called Music for Wellbeing. And also I'd like to acknowledge another charity, Canterbury Cantata Trust, which helped me to collect data. Well, as you saw in my title, I'm going to talk about singing, and I thought rather than making you sit through another more numbers and numbers, I thought my conclusion is in this song. So after this song, you can go for your dinner or nap or whatever. So I packed. So my conclusion is in this song. So I'm going to suggest that we sing this little song, which is very simple, and we do loads in with our participants, who are mostly 70 plus years old. So I'm sure you will do it quite okay. So this song goes like this: yay 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 yippee yay yay yay. And repeat it, yay, 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 yippee, yay, yay, yay. And second part is bony, bony, bone, my bony, 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 bone, my bony. Okay, you got that? So just to give you even more of a challenge, so I'm going to ask you to pat on your lap to give you a rhythm, and then sing with me. Yay, 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 yippee, yay, yay, yay. Yay, 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 yippee, yay, yay, yay. Bony, bony, bone, my bony, 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 bone, my bony. Fantastic. Okay, next challenge is this. You have to watch me, because I'm going to change my actions. Okay, so ready? Let's start with 1, 2, 3, 4. Yay, 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 yippee, yay, yay, yay. Yay, 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 yippee, yay, yay, yay. Bony, bony, bone. Next person, my bony. Next person's lap, bone. My bony. Okay. We have to try this again. Sorry. Okay, 1, 2, 3, 4. Yay, 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 yippee, yay, yay, yay. Yay, 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 yippee, yay, yay, yay. Bony, bony, bone, my bony, 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 bone, my bony. Thank you. Okay. So just give you the context. Perhaps I should tell you that I've been researching about singing and music, the health and well-being benefits from participating in group singing in particular. I've been working with people who live with long-term health conditions such as Parkinson's or chronic pain and stroke and other long-term health conditions, also mental health. And today I'm going to talk about our little study with older adults in UK, southeast of England. Now, sorry, I should step away so you can read. So the previous research shown that the group singing has got lots of benefits for older adults in terms of their well-being, specifically the thinking skills or friendship or connecting and being creative and learning new skills and memory and a number of things. Now, in this research, we wanted to find out whether there was a difference before pandemic and during the pandemic. And our hypothesis was that well-being will be lower and loneliness will be higher during pandemic than before the pre-pandemic period. And we wanted to understand the subjective well-being of all the adult singers in this context. So we follow two singing groups, and these singing groups are like not like a chamber choir or professional choirs, but this is open to all kind of choir. So there's no audition; people can come and join, and it's not about singing perfect, but it's all about having fun and just enjoy your voice. That type of community singing. And we wanted to follow these two groups over a longer period of time. So we started in 2019 without knowing there will be pandemic in 2020. So the first assessment we did was paper-based survey. And during the pandemic, we then did online-based survey with these adult singers. We asked them to complete loneliness scale. There are 6 questions, and also EQ5D, which is quality of life questionnaire. And also we asked some open-ended questions, what they found most helpful, beneficial from joining the singing groups. Okay, that's just a snap view of our participants who responded to our survey. So before pandemic, I'm sorry, you can't see the full I'm sorry, there's a much longer table, but somehow it's cut short. Well, this is my table. Basically, the groups were quite similar. White Caucasian dominant, and their age, their background very similar, and but I must also tell you that unfortunately these are not the same people. So there are some other people mixed in these results. That's because some adult singers didn't want to do online survey. Maybe they didn't know how to do it, or they couldn't be bothered. But who responded to us during pandemic, who probably want to tell us how they felt. Okay, this is just snapshot of our results. Just to show my fantastic graph. So the higher bar graph means worse health here. So EQ5D has 5 domains. So and the orange color is during the first lockdown in UK. So so people felt worsened mobility and worsened self-care and usual activity. Of course, they had less during pandemic. And in terms of pain and discomfort, much worse during pandemic, and mental health also much worse. Not a surprise here. EQ5D also asks how they feel today out of 100, so 0 to 100. 100 meaning perfect health, 0 is very, very, very bad health. And during pandemic, you can see people rated their own health much less. Again, not very surprised. Again, loneliness. This means people during pandemic, first lockdown, felt much lonelier compared with before pandemic. And this is more interesting data, I believe, because this is what people said to us. So there are some similarities before pandemic and during the first lockdown. People still experience some similar benefits from joining the singing. And also bear in mind, during the pandemic, they were meeting online. So before pandemic, it was in-person singing. Once a week they got together in the same room, and they had a live music going on and sitting in a circle singing next to each other. But during pandemic, they were sitting on their lounge or where in the house basically, and just watching computer screen to sing. And online singing doesn't allow you to sing at the same time. So what you have to do is you have to mute yourself. So basically you are hearing yourself only, and also the facilitator or the teacher who's doing the singing, leading the singing bits on the screen. So you can't hear other people. So it's quite different kind of settings. Okay, and importantly, these older adults, who some of them live with long-term health conditions, found that online singing offered them nullifying effects of lockdown. And they said they kind of experienced normality because this singing was regular thing. So Monday afternoon, it was normal for them to participate in singing, even if it was online. It wasn't quite the same experience because it was, as I explained, it was online. They couldn't hear other people singing. They couldn't experience the same feeling, singing together, making music together. They were only hearing their own voices. So it wasn't quite the same as before. And also loads of people said about the difficulties they had with technology, that, those Zoom things, they were first time for them to learn, and iPad and everything. But and some people also said because of the difficulty they didn't participate in online singing. Okay, I'm just coming to a few conclusions here. Overall, as we expected, well-being decreased during pandemic and loneliness increased in our sample of older adults southeast of England. There are some similar experiences from online singing and in-person singing, which were associated with well-being, being connected, feeling active, and experiencing some health benefits. The different experiences were associated with the settings. During pandemic, the online singing was different experience for them. Well, I like to highlight that online singing, though offered limited, but offered social connection. So people could still connect with others. People could meet and see other people. So singing facilitated these opportunities, which probably offered them some buffer for their well-being. Unfortunately, we have a number of limitations here. One, we don't have a comparison group, so we can only speculate that people who took part in online singing probably, although their loneliness increased and well-being decreased, probably that's, if we had a comparison group, probably the comparison group probably for them was much worse. Sorry, it's only my own speculation here. Okay, looking into the future, we believe that making online singing or in-person singing more accessible for all the adults is important when we're making health policy interventions for all the adults. And also, I'd like to add one more thing here, which is we really need to look at cost effectiveness of group singing interventions. It's now kind of common knowledge that group singing is good for you, it's beneficial for you, yes. Well, the evidence we need is now going forward, those cost effectiveness. So something like a social prescribing in the UK, they can invest more in group singing, and yeah. Okay, so I will stop there. Thank you for listening.